Thank you very, very much. Good afternoon. Great to be with you and to have Nathan invite me to talk to the Benjamin Rush Society is just a great, great privilege. I represent the 6th District of Georgia, which is northern suburban Atlanta, and as Nathan mentioned, spent 20 years practicing orthopedic surgery, and never dreamed I would be standing in front of an audience as a member of Congress. So I bring a perspective of that transition that I'll share with you a little bit, and then talk about why I believe it's so incredibly important to be involved in policy making as a physician, and talk about kind of where we stand right now as it relates to healthcare in this country, and share some positive solutions, because there are positive solutions, and then maybe lay out a challenge or two. Let's shift here a little bit and talk about principles of healthcare, because if you have a healthcare discussion, and you've had them, I know, regardless of your political stripe, doesn't make any difference, you've had them. Most folks have the top three, right? Accessibility, affordability, and quality. Most folks have those as principles of healthcare: accessibility, affordability, and quality. I add three to those. I add responsiveness and innovation and choices. But you can add as many as you want, or select from that group or not. But my six are affordability, accessibility, quality, responsiveness, innovation, and choices. Affordability. We need to have a system that's affordable, right? You can't have folks out there not being able to afford health care or health coverage. That just doesn't make any sense. And that's where we find ourselves right now. We've got 30 to 50 million, you pick the number, of folks that don't have health coverage. Some of them could afford it, many of them can't. And so we have a challenge in that arena right now. Accessibility. You gotta have a system that's accessible to patients. Doesn't do you any good if you're 150 miles from the closest acute care to be able to be delivered, right? And so it's acute, especially in a region and in a country that ought to be able to provide the highest accessibility for patients. Quality. We all want the highest quality of health care, no doubt about it. There are things that from a principle standpoint, that if you don't plug in the puzzle, you don't get to the highest quality. There are hurdles that you can put in the way that prevent the highest quality. Responsiveness, I put responsiveness in there. Most folks don't talk about it. 25% of our healthcare dollars, $600 billion. $600 billion in this country is wasted on tests that your doctor does, that you will do, if you haven't already, that I did, to make it so that if I ever found myself in a court of law, I could honestly look at the judge and jury and say, I did everything. Look, and then show the list of things that you did. And it was usually, 12, 15, 18, 25 things that you did, when you only really needed to do one or two, or three, to either diagnose the patient or treat the patient. But you did all of them, because you wanted to make certain that you could honestly say to the judge and jury, I did everything. That's the practice of defensive medicine, and it wastes hundreds of billions of dollars. Folks say, oh, Price, you've really overestimated it. Our number comes from RAND and a Gallup survey. But even if I'm off by a factor of 2, right? That's $300 billion, which is, imagine what you can do with $300 billion in terms of providing health coverage for folks and putting in place the appropriate incentives. So you can get folks covered, you can solve the insurance challenges, you can put medical decisions where they ought to be made, and you can solve the lawsuit abuse issues, the practice of defensive medicine. And notice that all of the things that I identified and outlined, none of them put the federal government in charge of a thing. You don't have to. You don't have to. That's to solve it in better ways. I talk to my friends on the other side of the aisle and others who think that the government ought to be running this whole show. And I say, what are you going to do when the doctors say, I'm not going to participate in that. I'm not going to participate in Medicare. 1 out of every 3 physicians in this country, private practicing physicians in this country, now limits the number of Medicare patients that they see, because the system is so flawed. 1 out of every 8 private practicing physicians in this country refuses to see Medicare patients, because they are unable to do so from a financial standpoint. Millions of folks not having that access to care. If you ask the folks on the other side, what are you going to do when doctors say, no, I'm not going to do that, I'm not going to participate in the exchange? Their response, what do you think their response is? Well, make it. How would you make it? There you go. What the plan is to say, if you're a physician in this country, we will allow you to have a state license if you participate in Medicare, Medicaid, and the exchanges, or you fill in the blank. So they're going to force you. Now, I would suggest to you that that is the height of subservience to a system that will tell you what to do for your patients, not what you can do for your patients. Wherever you end up after your education, wherever you practice your profession and your craft, get involved in the political process. It is so important for a variety of reasons, not the least of which is if you're not involved, somebody else is filling that space and is involved. And you have no way to know whether that individual is spouting the kind of issues and concerns that you have, or is pushing something that's diametrically opposed to what you believe is best, whether it's for your profession, whether it's for your community, whether it's for your family, whether it's for your kids' education, whatever it may be. If you're not involved, somebody else is involved, I promise you. And they knock on Doug Lamborn's door in line every single day. And if you're not there, then they are there. Secondly, make a commitment to vote in every single election, even for dog catcher. Do they still elect dog catchers? I don't think they still elect dog catchers. Every single election, and the rationale is the same. I asked this of high school and middle school and elementary school kids as well, and you all are brilliant and way beyond that phase. But if you ask a group of folks, what percent of the population does it take to get elected, to get voted into office? And real bright middle school kids will say 50% plus one. And high school kids will say 50% of maybe those who are registered vote. And the answer, sadly, is about 13% of the population, of the adult population. Why? Because only half of Americans, by and large, who are eligible to vote, register. And only about half of those vote. Now that ticks up from time to time based upon the enthusiasm in the population or a specific race. So it's about 25% of adults in this country vote, which means it takes about 13% to win an election. And sometimes it's even less than that. So your vote counts hugely, sometimes 8 times of what somebody else's vote, another person who isn't voting counts. So it is imperative that you vote and make a commitment. And sometimes it's not easy, but actually most states have made it pretty doggone easy to get to the polls these days. So make certain that you participate in voting. So let me thank you again for the opportunity to be with you. It is a great honor, and I, again, get involved and vote. And if you do that and encourage others to do the same, I have no doubt that we'll be able to turn this whole ship of state around. Thank you so much. God bless you.